During this training video, we will learn how to use the Compat Buddy gastrostomy button. The Compat Buddy button consists of 6 main parts: a purple feeding port compatible with button's extension set, an anti-reflux valve, a balloon inflation port, a closure cap, a tube shaft with different French sizes and lengths depending on patient needs, a silicone balloon to maintain the button's position in the stomach. The Compat Buddy button is available in different French sizes and lengths to meet the needs of patients throughout their journey. The French size and length are prescribed by the physician. Compat Buddy extension sets allow the connection of the button to an administration set or syringe. There are 7 different extension sets. Your physician or healthcare provider will help you choose the appropriate extension set. Always follow your physician's advice and the device instructions for use. Wash your hands with soap and water or with a hydroalcoholic solution. Prepare all necessary equipment on a clean work surface. 1 extension set to connect the button, 1 syringe and a glass of water for flushing, some gauzes. To administer the feed, it is necessary to be in a sitting or lying position, with the chest at a minimum of a 30-degree angle to avoid risk of regurgitation. The Compat Buddy button can be used with an administration set for pump feeding or gravity feeding. Prepare the pump or gravity administration set according to the instructions for use. Then, connect the extension set to the button. The Compat Buddy button has an anti-reflux valve, so the cap can be opened without risk of leakage. Take the extension set and close the clamp. Align the connecting tooth of the extension set to the groove of the button in order to insert the extension set into the feeding port. A simple way to do this is to align the tube of the extension set to the cap of the button. Gently press on the connector to insert it into the button. While keeping the button in place, do a 3/4 turn clockwise until you feel a slight resistance. The extension set is now connected. Using an ENFit syringe, flush the extension set with at least 10 ml of water for adults or 5 to 10 ml for children. Connect the syringe to the extension set, open the clamp of the extension set and flush. Before unscrewing the syringe, close the clamp of the extension set to prevent leakage. Screw the extension set onto the administration set. Open the clamp of the extension set and start feeding. The Compat Buddy button can also be used with a syringe for bolus feeding or for the administration of medication. Straight extension sets can be used for this purpose. Administer feeding with the ENFit syringe. Repeat until the required volume is fully administered. The ENFit syringe can also be used to administer medication, and administer each dose of medication separately. Flush between each administration with the appropriate volume of water. Always consult a physician before administering medication and follow the prescription. Administer liquid medication whenever possible to prevent clogging. The Compat Buddy button is also indicated for gastric decompression. To do this, connect the extension set to the button and open the clamp to release the air from the stomach. Always start each procedure by thoroughly washing your hands. Close the clamp of the extension set and disconnect the extension set from the administration set or the syringe. Fill an end-fit syringe with at least 10 milliliters of water for adults or 5 to 10 milliliters for children. Connect the syringe to the extension set and open the clamp. Flush by injecting the water contained in the syringe. Close the clamp and remove the syringe. Flushing is now complete. Disconnect the extension set from the button. To do this, do a 3/4 turn anti-clockwise. The tube of the extension set should be aligned with the cap of the button. Gently remove the extension set from the button. Clean the gastrostomy button using a gauze, then close the cap. After each use, thoroughly rinse the extension set under warm water with soap. Allow it to air dry. Then store it in a clean place for its next use. To limit the risk of infection, always start by washing your hands with soap and water or with a hydroalcoholic solution. If you find residue on the skin around the stoma, use a cotton bud or gauze pad with lukewarm water and soap to clean it if needed. Be sure to always keep the skin around the stoma clean and dry, and check the stoma daily for any oozing or redness. Once the stoma has healed, it is no longer necessary to use the dressing. A clean, dry gauze pad can be placed between the skin and the button to reduce rubbing. Never leave a dirty or wet gauze in place. Make sure that the button is always clean and the cap closed properly between each administration. Give the button 1/2 turn every day to prevent sticking and skin irritation. If the button moves or liquid leaks around the stoma, or at the request of your physician, check the remaining water volume in the balloon. To do this, use a syringe compatible with the inflation valve to aspirate the water contained in the balloon. Make sure the button remains in place throughout the procedure. Compare the water volume in the syringe with the volume mentioned on the balloon valve or with the volume prescribed, and inform your physician if necessary. Replace the water in the syringe with clean water and re-inflate the balloon with the appropriate volume of water. When you inject the water, take care to push the button down to the bottom so that the balloon inflates in the stomach. Inflation should be painless. Once the balloon is inflated, tug the button gently to confirm its correct placement. Make sure that it turns freely by doing a complete turn clockwise. The sitting or reclining position of at least 30 degrees must be maintained in order to avoid reflux or regurgitation. In case of diarrhea or constipation, the administration method, delivery rate, or the type of formula can be adjusted. Consult your physician about this. To prevent obstructions, flush the tube using a syringe before and after each use with the appropriate volume of water. In case of obstruction, inject water into the tube through the extension set with a 1 to 5 milliliter end-fit syringe. Press on the syringe plunger and open the clamp at the same time to increase the pressure and unclog the system. Repeat until the obstruction is completely removed. Seek medical advice if leakage appears around the stoma. It is possible that the balloon needs to be re-inflated or the button replaced. If you notice irritation of the skin around the stoma or the appearance of granulation tissue, inform your physician or healthcare provider. In the event of accidental removal, a replacement button is generally available at the patient's home so that the button can be replaced. If you have not been trained in the procedures, or if you do not have a replacement button, go to the emergency department immediately, as the stoma opening can close up in 4 to 6 hours.